Okay, so today what are we talking about? Understanding diabetes. I want to talk to you from my heart about diabetes. There's a lot going on with diabetes, and I want to make sure um, anyone listening to Dr. Evangeline Obi understands what diabetes is. Okay, it is a talk from my heart to anyone struggling with diabetes. Anyone that has a family member, a loved one struggling with diabetes to fully understand what diabetes means. Again, this is Dr. Evangeline Obi, and I'm speaking as the CEO of Mayafa Incorporated. Mayafa is a nonprofit organization here to educate people to know and understand um, disease conditions, how to prevent it, and also for those that have it, how to better take care of it. Okay. So, what is diabetes? I know there is Google, there is social media, AI. Anybody can Google and find out diabetes. What is diabetes? But as a physician, I would define it based on diagnosis. So, diabetes is when there is abnormal sugar metabolism in the body. There are different types, but my focus is on the diagnosis of diabetes. Bigger population of people have type 2, which in the past is usually seen in older people, 40 years and above. But now, because of increase in overweight, obesity, diabetes is also seen in younger people, 30 years, sometimes 20 years, type 2 diabetes, which is where there is insulin production, but it's inadequate for the sugar metabolism in the body, thus causing high blood sugar. So, by definition, diabetes is when your fasting blood sugar is 126 milligram per deciliter or higher. Okay. And then hemoglobin A1C, and this is checked at two different times. Hemoglobin A1C is the best used because it has no relation to food. And hemoglobin A1C is amount of sugar in the body that is amount of hemoglobin in the blood that is glycosylated. So when it's normal should be 4.8 to 5.6. 5.7 to 6.4 is pre-diabetes, and 6.5 and greater is diabetes. So we should do everything to keep it at 5.6 or lower. And when you're diabetic and you're being treated, your doctor will want your hemoglobin A1C to be less than 7. That is usually the goal for the majority of the people with diabetes. Because we have talked a lot on diabetes, I don't want to focus on the incidence, the prevalence. We know diabetes is high and it's on the increase based on poor um, lifestyle choices that people make. So that's why we need to really work hard to cut back on. One is sugar intake. Sugar intake, many people say, I've heard patients say, oh, I don't have diabetes, I don't eat sugar. Everything we eat is converted to glucose, which is the smallest form of energy the body can use for energy. So, glucose, whatever we eat, starch is converted to glucose, and the body uses it for energy. The brain, especially, cannot do without readily available glucose. So, we need to eat, but eat sensibly, eat enough to keep us going. I've heard the saying, I eat to live, not live to eat. So, we eat to survive, to get through the day, but not to, our life is not all about eating. So let's understand it. But then what about those people who eat healthy? They eat healthy, but the sugar is still high. They still struggle with diabetes. And that's what my focus today is to make sure. I've had patients say, oh, I don't eat sugar, I stay active, but my sugar is high. Okay, I'll explain that in two forms. So the first is those who have a family history of diabetes. Diabetes is said to be not genetic, but remember, you learned habits. You eat about the same thing, you do about the same thing, and the body gets used to those things and can put you at risk for diabetes, just like your family members also have diabetes. So even when you eat healthy, you stay active, do everything right, you may still have diabetes. So in that case, you just have to know your numbers, monitor and watch it closely with your doctor. And if you need medication, your doctor will start you on medication. Then the other group are those that are already diabetic and they are doing everything the same. They are eating healthy, staying active, maybe taking their medication, but all of a sudden their sugar is going up. That's my focus today because I've seen that happen. Family members taking care of elderly one and they can't understand why the sugar is going high. And also people who are learned monitoring their sugar and it's been normal, but all of a sudden it's going high. Yes, other things that can raise your blood sugar besides what you eat and what you do could be infection. Infection, yes. When your sugar starts going high and you've been doing about the same thing you normally do, it is time to pay attention to your body. See if you're having a cold, cough, a fever, chills, or if you're having some urinary symptoms, which is commonly the cause of that urinary tract infection. Some don't have classic symptoms, but may have incontinence of frequency, which they attributed to their diabetes and high sugar. So make sure you see your doctor on time. Don't wait until you have a full blown infection. Go to your doctor so your doctor check your blood, check your urine, make sure there's no infection or any sign of infection. Other things can be inflammation. Sugar can continue to be high, though you're doing the right things, and sometimes it's called pre-diabetes, but it's just your body being stressed. So stress can cause inflammation in the body and cause your sugar to be high. Yes, it's possible. It could be inflammation with what you're putting in your body. Your body is constantly reacting to it. Your gut health is suffering and you're not paying attention to it, and your sugar can be rising, and your doctor chasing it with medication. No, you need to get fully evaluated, um, mostly by a doctor that doesn't do conventional medicine, but maybe functional medicine to do full cellular testing and figure out what's going on. And we can help you. And then make sure you're not stressing yourself. You're not worrying too much. You're not keeping sleepless nights. That you may not even, that you don't have sleep apnea. Some people have sleep apnea and don't know it, and it puts the body in constant state of stress. So make sure you're checked for stress. Make sure you're not anxious, depressed. Make sure you don't have anything that constantly stress your body because all it does is just raise your sugar and your doctor keeps chasing it with medication. And at the end of the day, you're just taking too many medications that you don't really need. So these are things I'd like for people to understand. And if you have diabetes and your doctor is treating you for diabetes with a goal A1C of less than 7, for you to achieve that, your fasting blood sugar has to be always less than 126. It's best if it's between 80 and 120. Your fasting blood sugar, when you haven't eaten for 8 hours or longer, your sugar should be less than 126. And if you're checking it before lunch and dinner, which is not truly fasting sugar, it should be less than 180. Best to be around 150. If you're getting 200 at home, checking your blood sugar, then your A1C would never be less than 7. You have to do all you can to bring it down. Work closely with your doctor, know your numbers, and take good care of yourself. Make sure no infection anywhere. Make sure you're getting your feet checked by your podiatrist, or you look at it yourself if you don't have neuropathy already. But if you do have neuropathy, follow with a podiatrist to make sure you're not losing sensation in your feet and maybe having infection that can turn to gangrene quickly, depending on how controlled your diabetes is. Make sure you're getting your eyes checked. You're seeing your eye doctor every year to get annual eye exam to, prevent retinopathy and catch it on time if it does happen. This is a complication of diabetes. And also make sure you're getting your kidney checked. Every year you do your annual physical with your primary doctor and have your urine microalbumin creatinine ratio checked. Get your chemistry done. Make sure no kidney involvement. And CBC, of course, make sure no infection starting somewhere, any sign of infection with high white blood cell count. You have to be really followed closely. Diabetes puts you at risk for early infection. So make sure you're checked on time. And if you have any sign of infection, fever, chills, headaches, make sure it is checked out. Don't sit at home like every other person because diabetes, that high sugar in blood, suppresses your immune system and you pick up infection quicker than other people. So, with this few talk of mine today, I hope you have a better understanding of diabetes mellitus. And if it's type 1, follow with your doctor more closely because those are dependent on insulin. Monitor your sugar, know your numbers, know what they mean, know when to ask for help. Protect yourself. Protect yourself. Get your immunizations. It is very important. Flu vaccine every year, pneumococcal vaccine. Make sure you're up to date on that because, again, diabetes puts you at risk for infection. And diabetics are more likely to have bilateral pneumonia and end up in the hospital, ICU even. So make sure your immunizations are up to date. And also shingles vaccine that they give, usually given at 50 years and above. It is a 2-dose series. Make sure you're up to date on your immunizations. These are all part of protections for you, especially with diabetes. And if you have chronic kidney disease already, follow closely with your doctor and maybe refer to nephrologist on time to prevent being on dialysis. So I want to make sure that you understand everything you need to know about diabetes to protect yourself or a loved one and prevent complications or even preventable death. So please take care of yourselves. It is Dr. Evangeline Obi with Mayafa Incorporated. We can be reached at mayafainc at gmail.com. Mayafainc at gmail.com. I will spell it MYAFAINC at gmail.com. Or you can also check us out on our website, mayafainc.com. Mayafainc.com. MYAFAINC.com. We want you to be well educated. No matter what you read online, it will not connect the dots for you. But I am here to help you. And if you have questions, always come with your questions. Let us know your questions and I can help you. Thank you all. Remain blessed. Know that Evangeline love you all and want the best for everyone. Take care. Any question that is typed in the chat? I see a comment. All right. Take care.